SHA today, day one of that new dispensation as far as health financing and health insurance in the country is concerned. The PS in Medical Services, Ministry of Health, Harry Kimtai joining us. It's been a long day for you. Thank you for being with us once again. Let's talk about the progress of registration. I know there's numbers that you've given. Give us those numbers, but also tell us what registration essentially means. Once you've done that, what does that mean? Then you can go to any hospital, public, private, get healthcare?
Thank you. I think today is one of those days that to Kenyans we will all remember, because it was the rollout of the universal healthcare coverage. And we started today because we had informed Kenyans that come 1st of October, we shall be migrating from NHIF to Social Health Authority. Registration process has been ongoing, and as of today, we have registered 2.6 million Kenyans. And also, today, we were able to migrate the faithful beneficiaries of NHIF, 9 million of them. That gives us total was about 12.5 million. And all this is because we have laws that we passed that will support the new Social Health Authority. Specifically, the Social Health Act, which talks about the 3 funds.
Yeah.
One is the Primary Healthcare Fund, which is supporting Kenyans at level 2 and level 3, where the national government pays for them, so they will have the free medical cover. Then the second fund is the Social Health Insurance Fund, which Kenyans refer to it as SHIF. This one is a contributory where you're supposed to pay your 2.75% of your gross income. Then the third fund is the Emergency, Chronic and Critical Illness Fund, again funded by the government, where Kenyans, those who will find themselves in an emergency situation, will be treated within the 24 hours without paying.
Okay.
And those who having chronic diseases and who are in critical condition also will have to be treated without paying.
Okay, let's talk about that migration for a moment. Does the law allow that to happen?
Yes, we made a provision within our regulations to to allow for migration of those who are in NHIF to continue with their Social Health Authority fund, meaning that since they were already members of NHIF, they were to be migrated to the Social Health Authority.
So that's in the regulations?
That is in the regulations.
All right. So those who are under NHIF need not register afresh?
They need not register. We sent them messages earlier telling them that you will receive your benefit packages or insurance cover under the Social Health Authority. And we shall continue communicating to them, so they will be aware and they will be given the options. Okay. And unless somebody wants to opt out, then he can opt out.
But it's mandatory, isn't it?
It is mandatory.
So there's no opting out?
No opting out.
Okay.
Yeah.
Let's talk about the contributions, the SHIF, which is contributory. For the employed, it's easy. At the end of this month, there will simply be a statutory deduction from their salaries. How about for the unemployed? The acting CEO of SHA himself said the accuracy levels for the means testing is quite low. Have you worked out this means testing, and how soon will those contribute?
The initial means testing tool that we developed gave that very low accuracy. We do agree, because we tested it across the country, picked some counties, and we found out that it was low. What we did is we again went back to the field and collected the correct parameters that will be able to give us accuracy of our means testing. This we did in about 8 counties. And as a result of this sample size that we collected, we believe our accuracy level is above 85%.
Because those who don't contribute, the unemployed, will not get services under SHIF.
Those who do not contribute under SHIF will not get services because it is contributory. But those who have registered under Social Health Authority at level 2 and level 3 will be entitled to medical services, because it is provided for by the national government.
Tell me, how many staff do you have at SHA?
The current staff, because NHIF had 1,743 staff, but because the Act provided for transition of staff to the Social Health Authority, we needed to get approval of our human resource instruments from the public service. What we did is we seek for approval, and we were given an interim figure of 845.
845?
485.
Okay.
Now, this 485 is what we have said interim, because we are still populating the staff at Social Health Authority. So we are starting with 485.
Okay, so
and
do
then
you
we shall
have,
continue.
so who's there now?
At the moment, we have the CEO is the only acting one, together with the Corporation Secretary. Those are the two who are acting. The rest of the staff are employees of NHIF who have transited temporarily to Social Health Authority. We are waiting for a process called interview and application.
One moment. According to SHA, there was supposed to be a fresh recruitment of staff. These NHIF workers who are working under a law that became defunct at midnight last night, how are they working legally at SHA when they were in a process that is now defunct with a law that ceased to exist on the 30th of September?
That law is not defunct. It is still in operation, and until 22nd of November 2024. So the provisions of the law is what we are using, meaning that the staff, the current staff of NHIF shall, on application and vetting process, will be transited to Social Health Authority.
So what you're saying is NHIF did not cease to exist last night?
No. We said the services, medical insurance cover for NHIF ceased being operational the midnight of 30th, yesterday. From today first, we are having services under Social Health Authority. So it is only on the services, on the provisional or medical cover, that we are now under SHA. But the staff are still to go through the process of vetting to Social Health Authority.
How is it working with the hospitals and the health centers? Just this morning on our show on Daybreak, hosted by Ayub Abdikadir, the Rural Health Hospitals Association is saying their members and their institutions have not been onboarded in the process. So, how does this work, particularly for patient services who will go to an institution seeking healthcare, but those institutions are saying we have no visibility with SHA and therefore don't know how to provide the services?
Today, I think I can tell you, Bungoma, Kisumu, Homa Bay, we had a large number of people who are seeking medical cover, especially in the public hospitals, level 2, level 3, because we told them register and you start getting your free medical services. We have contracted, as the Social Health Authority will continue contracting the private facility owners to be onboarded into the Social Health Authority. It is something that takes time. And again, they have been given the forms. It is them to opt in and say, I want to provide service.
Why didn't this happen before today?
That's been ongoing.
Okay, so when Dr. Brian Lishenga says we are not ready for SHA, no single healthcare provider has a contract with it, is he lying? Or are you the one not being truthful tonight?
They have been given the forms, and we expect them to fill the forms. So we expect those who have filled and signed the forms to submit back to NHIF. We gave them the forms much early.
When?
Immediately the law came into effect and we passed the regulations. They are aware. We had meetings with them and they know the benefit packages that they are supposed to offer to the NHIF members. So those who have not opted, I know we have already applications that we have received through KMBDC. We have about over 7,000 private facilities and 4,800 public facilities. So all these are ones that we are processing.
What is NHIF's liability?
NHIF liability, in terms of...
what do they owe? Who do they owe?
They owe the private and the government facilities, they owe 30 billion.
So now with challenges of 30 billion that is owed by NHIF, counties not remitting their monies, how can anyone trust that SHIF will be better than being under NHIF? And these institutions continue to suffer under the burden of 30 billion shillings plus that is owed to them. And now, even in the primary healthcare, which the intention was to be 60 billion, now has been allocated, primary healthcare was supposed to be 68 or moved to 50 billion, now allocated just 4 billion. The emergency fund that was supposed to be 75 billion, now allocated only 2 billion for emergency and chronic and critical care. And then there is NHIF's historical debt of 30 billion. It's still weighed under this huge amount of debt.
Let me start by saying that the primary healthcare fund, this is the first time we are allocating the fund. And we started with the projections of about 58 or 50 billion. First supplementary, we were allocated 4.1. And this will continue as we onboard many of the Kenyans who are seeking primary health care at the level 2 and level 3. So this is something that we have started with allocation of 4 billion, and we shall continue allocating them as we go for supplementary and as we deliver services. For the SHIF, that is a social health insurance, that is contributory. We have no problem with that. The issue of the outstanding liabilities, these are ongoing because we keep on collecting and then paying. So this is something that is ongoing because we also...
So when can the health centers expect and hospitals expect to be paid their monies? Because that affects the service provision.
Every month they are paid.
How much?
Sometimes we pay like 4 billion.
So you pay 4 billion every month?
Yes.
Since when?
No, we've been paying. If you've been following, every time we have the money, allocated money, say, for example, when we have money for Linda Mama, in the last financial year, we had money for Linda Mama, 4 billion. This year, we have money for Linda Mama, we have 2 billion. We have money for the vulnerable. We have about 850 million. So all this is money.
I'm talking about the monies that are owed to these hospitals in terms of reimbursements.
The money, once we collect the money, like every month, we receive collections. 9th of every month, we do receive collections. So how much of that money are you then dedicating or allocating to paying this outstanding debt of 30 billion? Every facility is paid according to the money they receive. So that's the time when they pay the money as per the collections. But I'm sure you have a total figure for how much you owe all of them. We normally pay like about 4 billion almost every month to the facilities, and it's distributed both in the public, private, and faith-based. All right, I want to talk just very quickly as we close about the digital hospital management software. The deal for which we're told is 104 billion shillings paid to 3 companies to be repayable or recoverable over what period? 10 years. Okay. Who is paying for this? I think it is not money that we are paying. This is the contract that we've been given where the government entered into arrangements with a consortium led by Safaricom, and they are going to have their investments in the first 2 years. So they will continue investing in digitizing our ecosystem, our health ecosystem, for the first 2 years. And then they will be recovering their money as they go along. And within a period of 10 years, they will have recovered their money. From whom? Who is going to pay them? Of course, from whatever money that you're going to collect, because we have developed an ecosystem which requires that those who are going to fit into the national digital superhighway, some of them will be paying for the fees, and those are the fees that we shall use to pay back the investment. So it's SHA paying for it? We have digitized our 3 institutions. One KEMSA will also be part of it within our digital ecosystem. We have SHA, which is also part of the ecosystem. We have the Pharmacy and Poisons Board, which will also be part of the ecosystem. So all these, and now also because we are going to bring in the private facilities which will be linked to this digital superhighway because they are supposed
Okay, so you've
to
talked
provide
about the ones
service.
who are linked to it. I'm
Yeah.
asking, who's going to be paying this 104 billion over the 10 years?
It is the fees that we are going to collect
From?
from the services that we are going to render under digital health agency, because that is the body.
Which is under SHA.
No, that is a new body. It's a
Okay.
new agency
Yes.
called Digital Health Agency that now will be collecting fees out of these collections because they are providing service. They are providing service to SHA, they are providing service to KEMSA, they are providing service to Pharmacy and Poisons Board in terms of the digital ecosystem, and also providing service to private facilities and government facilities who will be linked within the National Digital Superhighway.
Okay, and all of this is 104 billion. What's the total sort of allocation for SHA, including SHIF, primary emergency?
The total allocation, for example, we can't estimate on the yield from the SHIF, which is projected based on our collections. And then we have the government allocation for the primary health care fund and also allocation for, which I've said we have started.
Based on the projections,
Yes.
Let's do it together. 148 from SHIF, projections for collections.
148 billion.
Okay, and then the 4 billion
The 4 billion is what we have currently, but you're saying that's not the
for 152,
Yes,
and then 2 billion.
yes,
So that's 154.
yep.
Okay, and the cost is 104 billion shillings. There is something about the cost of administration of SHA. What is the required percentage of the cost of administration
The
out of
cost
the
of
total?
administration of SHA is 5%.
5%. 104 billion shillings for this digital software versus 154. Does that not exceed?
When you do such kind of maths, you'll not get it right. Look at the investment. Look at what they are offering and the other fees that they will also be collecting.
But these are your own regulations, which you've just said the cost of administration should not exceed 5%
Yes.
of the total allocation. 104 billion shillings of 154 is way more than 5%. So why would SHA or why would the country be spending all of this money on a digital software, which is essentially administration, possibly important in terms of interlinking the institutions?
I think you need
versus, I'm just asking,
All
because
right,
we want to understand, versus how much you're actually allocating towards providing healthcare services.
If you look at it in terms of comparison, how much are you getting and how much are you supposed to pay, then you will miss the point.
So how much are you supposed to pay then every year?
Look at the investment that we are putting in first, because we have to digitize our ecosystem. So the first 2 years, there's going to be an investment of over 24 billion Kenya shillings. And subsequently, there will be additional investments where they are going to change, say, if it's supplied the equipment, after a while, they have to replenish or change those equipments, basically on the national facilities. So we are digitizing all our national facilities. So there will be a lot of investment in the initial years, which you are saying the government is not putting the upfront that kind of investment.
Okay, so how much will you be paying per year then, once you start repaying back this investment?
So if you divide that by 10 years, divide by per month, how much? Because we start collection, we've given ourselves 6 months.
Well, you tell me, what are the allocations and projections that you've seen?
We are still working on the allocations in terms of what are we going to get the yield, and then from there we'll be able to see. But
So you haven't worked it out
we
yet?
have worked it out. We are coming about 150 million per month that will be repaid.
Okay, all right. Thank you very much. A final message to Kenyans who today have also experienced some serious hitches in terms of accessing their healthcare, particularly those with chronic conditions. Despite the statement that came out from SHA yesterday and the directive that nobody should be denied medical services, there are some people who've had to go out of pocket today.
In the morning, when Kenyans went to seek their services, there are those facilities that were not aware or they are not entered into the arrangements with the Social Health Authority. Those ones in the morning, they faced some challenges. And we were able to get in touch with the health providers, informed them on how the claims will be processed because we are afraid, how are they going to claim? So a few of them were denied services, especially those who had booked their services, and they were told, now you have to come with cash. We were able to communicate with them. We were able to get in touch with those families, and we told them to go back. So most
but
of them.
But there are some people who paid today, PS.
Actually, I have one case.
I have
one case which I know they paid, but I think that facility, when we got in touch with them, we informed them the procedures that we have now developed, and they accepted and they agreed. They said, okay, fine. If that is the case, then we shall now provide service in the normal arrangements that they have been having with the Social Health Authority or the previous NHIF. Because they did not receive communication, maybe they did not know on how they are going to do the reimbursements. But now everything has been clarified, they know, and we hope.
So tomorrow there will be no such stories?
This afternoon there will be no there are no stories.
So
tomorrow we also expect the same.
Okay.
And unless, as I said, there are those facilities which do not want to opt to provide service, those ones now we shall advise members of the public that these are the ones who have opted and they can go to these ones and they will get
and
their
all
services.
of this could not have been done before the 1st of October? Because things were being done on the day.
You see, we have to start from somewhere. We have to start on this day. So it happened this day. We had informed them. They knew. But of course, some of them, sometimes they think they're still doubtful. And we told them, we called them, we participated with them, we sent their managers, and they're able to be clarified. Issues which they don't know from day one.
Okay.
They faced some challenges.
All right.
Normally, we expect normal services now to resume, and unless that facility does not want to be empaneled.
Okay. So if people don't receive services tomorrow, it'll be those health services centers that have refused to onboard. That's what you're saying?
Yes.
And that there will be no issues from tomorrow?
Yes.
Okay. We'll hold you
Even
to that.
today afternoon, by the way, if you checked, if you send your reporters, they were there in the morning and you were able to follow up with them.
Okay.
In the afternoon, we never had an inch.
Okay.
Yes.
We shall take your word for it. PS Harry Kimtai, thank you very much from the Ministry of Health, joining us here on day one of SHA, and see what happens day 2 and going forward. Let's take a break. When we come back, we talk about the impeachment, and we're speaking with constitutional lawyers on the process and the way forward. We'll be back.